Good morning. Okay, today is Saturday, uh, April 6, 2024. This is our regular yoga therapy session. Let's look at a little sound check. Check, check, check. Sound check. Check, check. Okay, let me say again. Yeah, sound is good. Uh, I can hear, and I also hear from Linda. Linda, thank you for the sound check. So we are doing again the requests. So today's request is a big name called Interstitial Fibrosis. Obviously, one of our physician friend who is suffering from interstitial fibrosis of the lung requested me. So you, as a long-term yoga practitioner, yoga therapy teachers, healthcare providers, let me go over with you first the physiology, the pathology, which we call patho-physiology of the disease. So, coming back, it's a big name, interstitial. Interstitial basically means in between cells. In between cells of a structure, fibrosis means scarring, laying your called fibroblast, the tissue which causes our healing. As you know, the lung, we take the air through our nose, then it goes into a main channel called trachea, then it goes to the bronchi, then it divides into small channels, small like a branch of a tree called bronchiole. It ends up in a sac called alveoli. So one side of the sac, we have the air which take in with the oxygenated air, and other side is your capillaries, which carries the blood, called deoxygenated blood, which carries carbon dioxide. And between this sac in the lung and your blood vessels or the capillaries, there is an exchange. And oxygen goes to the lung, oxygen goes to the blood, which is picked up by the hemoglobin, and carbon dioxide comes back to the sac, and it comes out with the outbreath. In between these two, this sac of the lung gets damaged. When it gets damaged, it has a healing called fibrosis. In common term, what you can say, suppose I have a cut. And when I have a cut, what happens? And slowly it heals. If a big cut, we put some sutures, we put some stitches, but those are just to approximate. The healing takes place, and when the proper healing takes place, the cut will be nice, linear, you won't be able to see a scar. But if the fibroblast, the process becomes more, prolific, means more fibroblasts are coming in for unknown reason, you will see the scar will have a thick scar, which you call a keloid. Keloid is very common in a lot of population, including the dark skin people. So it's basically the same phenomena. The sac of the lung getting exposed, and then during healing process, it is a very rapid process of laying the fibroblast. So this is called the idiopathic. Idiopathic means we don't know the cause. Irreversible. That means it is not reversing back, and it's a progressive, and unfortunately it kills people. We all die. So the first, as I said, we don't know the cause, which is called idiopathic. Second, what we know, exposure to your hazardous material. So number one, exposure to the lung, which is going to cause, is smoking. Obviously, we know the smoking, and also the polluted air. The air we are breathing in, especially the cities which are polluted cities. Third, some chemicals or components we know called like asbestos. Asbestos is being banned from also. Asbestos first also causes a damage to the lung and essentially ends up with your cancer of the lung. That's why asbestos is being banned. New one is called silicosis, silica. We know the silica causes silicosis, and unfortunately these days what we find out that the synthetic countertop, what do you call them, quartz. The quartz, when the quartz they polish, the dust which comes out from the quartz is a silica, silicosis. And a lot of other environmental factors are there, but the most important thing is that the the lung gets damaged. Next one is the radiation. Like people are having radiation for the breast cancer or other this part of related radiation. Radiation causes damage to the lung. It's a part of your autoimmune diseases. Autoimmune diseases like rheumatoid arthritis, say sarcoidosis. Sarcoidosis affects lung. Sarcoidosis, scleroderma, connective tissue disorders. What else? Some collagen vascular disease also. What else? Okay, sometimes from your medication, chemotherapy, some cardiac medication, some antibiotics, anti-inflammatory. Look at a lot of other medications also can cause this, but one condition which many people overlooks, which can cause interstitial pulmonary fibrosis, is a gastroesophageal reflux. We call it a GERD, G-E-R-D, gastroesophageal reflux disease. There is no medication, there is no therapy. Yes, there is one medication, now there are two medications approved by FDA. These medications apparently it slows down the fibroblastic process. So it's sort of like reduces your body's response for being fibroblast in that area. So if you look at the lung volume and capacity, that how yoga is going to help. Yoga is not going to reverse the disease, but it is going to cause the good quality living as long as we have. Look at the volume and capacity of lung. Lung has a 6-liter capacity. Out of the 6 liter, we need 1.5 liter to keep the lung open. It's called residual air. Out of which 6 liter, out of 1.5, 4.5 liter air can be exchanged through our breathing. which is called a vital capacity. And normally with every breath we take in, now unconscious breathing, normal breathing is only 500 cc, half a liter. You're taking half a liter in and out, of which half a liter is, out of which is 150 cc in the top is called a dead space. They're not doing an exchange. So you can think about it. You have 3 liters of air which you can breathe in. That is called inspiratory capacity. That means with proper training and voluntary training, you can breathe in 3 liters, and expiratory reserve, you can breathe out about 1.5 liter. Now the muscles of the respiration, all the muscles we breathe are skeletal muscles. They can be trained. And when you train the skeletal muscles, what happens? The way I'm breathing now, I can breathe maybe 4 seconds out, 2 seconds in, and if I keep on doing it every day, slowly and slowly, I'll be able to do, say, 8 seconds out, 4 seconds in, and we can do, we do it practicing for a long time. We can do it 8 seconds in, 16 seconds out, 10 seconds in, 20 seconds out. It's like a training your skeletal muscles. Like if you're doing a weight training, you can do 5 pounds, within a short time you go 10 pounds, then you go to 15 pounds, then you go to 20 pounds. You go because it is a habit forming called neuroplasticity. So now, what are the yoga practice which is going to cause our proper good living with this interstitial pulmonary fibrosis? First, people say they would like to do pranayama. Pranayama is a voluntary regulated breathing, but the issue of pranayama is that people who have a shortness of breath or breathing difficulty, they're very anxious. See, what happens in interstitial pulmonary fibrosis, slowly and slowly, your breathing gets difficult, which you call a shortness of breath. And with the long term, you develop a hypertension of the right side of the lung and heart, which you call a pulmonary hypertension of your lung blood vessels. And also you have a right-sided heart failure. We have 2 heart, left heart and right heart, as we know, divided. So right-sided heart failure, which is called cor pulmonale. So you cannot sit down and start with the pranayama. The first, this is called your yogic kosha model, 5 koshas, annamaya kosha, physical body. Imbalance of that physical body can get imbalance, you get a imbalance in your breath. Pranamaya kosha. Like you can do, if you keep doing it, say I'm going to do a twist. Slowly and slowly, more and more twist I do, essentially I feel that I have an effort in breathing. Because heart and lung is the same organ. When you put a stress to the heart, you get a effort in breathing, and if you put a stress to your lung, your heart rate goes high up, your heart blood pressure will go high up. It is the same organ. So you have to learn that if you get an imbalance in your breath, pranamaya kosha, it affects your mind, monomaya kosha. When I cannot breathe, I get very anxious, I get very tense. And when I get a monomaya kosha, mind becomes anxious, then it becomes your intellect. Viganomaya kosha. I lose my rationality. What to do. When I lose my rationality, you end up with a called imbalance of your anandamaya kosha or I'm totally in balance. So, first, the hand mudras. Hand is connected to your body and mind. As you know, hand will react to your mind before even your body acts. Like, see, if I do something good, I'll say this. Before I can say this good. If I want something, I will do this before I say give it to me. So the hand quiets down your body and mind. This is called your dhyana mudra or jnana mudra. This is a meditation mudra, touching the index finger and thumb. It quiets down your mind. So you always do our yoga practice like this. This called Balo Mushti Mudra. Put your thumb inside and close. This is the way the baby closes the fist. It's called the baby fist, Balo Mushti. So always close your fist like this. You'll see your hand get relaxed. When your hand gets relaxed, your body will get relaxed. Your respiratory muscles will get relaxed. You'll be able to breathe properly. One mudra, which is very specific for controlling your anxiety, to quiet down your mind, is called your Shankha mudra. Shankha is a conch shell. Your hand will look like a conch shell. So look at this. Two hands, okay? Take your right hand, wrap around your left thumb. Take your 3 fingers, wrap it around your hand, touch your index finger and thumb, and take a look at it. It will show it to you close by. It will look like your conch shell. Okay? Shankha mudra. You can do it the same way on the other side. Left hand wraps around your thumb, right hand wraps around, touch index finger and thumb. And when you do it for quite often, what happens, we can assess our subtle body. We can do it with the eyes closed. Because the eyes closed, you can touch. My eyes are closed. My eyes are closed. My right hand wraps around my left thumb. Left hand wraps around my right hand. And I'm doing a Shankha mudra. You can see. With my eyes closed. With the same way, my eyes closed, I can do the same thing. So, do a Shankha mudra first, and then put your hand, or maybe let's go in a chair. We'll do a session in a chair. So you will see, we'll do some asanas, and very simple asanas, and we'll tell you which asanas are good for your interstitial pulmonary fibrosis. Here is my Shankha mudra, or you can do a dhyana mudra or jnana mudra, index finger and thumb. I prefer the Shankha mudra. Then I close my eyes. Close my eyes. I pay attention to my breathing. Bring your awareness to your breath. Also sit down with your spine straight. I was sitting in the kneeling stool with my spine straight, in my chair, in my spine straight, eyes closed. Learn how to breathe out first. Lung is like a balloon. You cannot bring more air in unless you empty the lung. So breathe out first. Do not count, do not force. It has to be as if it's your normal breath. Then slowly breathe in without any effort. You will be easily able to do 4 seconds out, like 1 and 2 and a 3 and a 4 out, and 2 seconds in, 1 and 2 in. Now normally our respiratory rate, breathing rate is between 15 to 16 per minute. Here my breathing rate became, within a 6 second cycle, 10 per minute. Breathing is both conscious and subconscious. Subconscious breathing, when I'm sleeping, I'm still breathing, which comes from your brainstem. Conscious breathing, I can awake, I can deep breath in and out. Which comes from your cortex of your brain. Slowly and slowly, if you practice it daily, you will be able to see that the breathing becomes more and more relaxed. You will be able to do a lot more, breathe out a lot longer than breathing in. Breathing out is parasympathetic and breathing in is sympathetic. Next, the quieting down your mind starts with your pranayama called Bhramri pranayama, a bumblebee breathing. In a Bhramri pranayama, what you do is shut down your 5 senses, then you create a vibration, and for my practice I always do with my eyes closed. My eyes are closed, I'm not looking at anything, and all my awareness is in my inner body. Put my index finger on the forehead. I can use a Shanmukhi mudra, or I close my eyes with 3 fingers. Use your thumb to close your ear, and you breathe out through your nostril first. Then take a deep breath in, breathe out with the sound of a bumblebee. Then the pumping and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Take the hands like a cup. Put it over your eyes. Let the eyes take all the heat from your hand. Then massage your forehead, massage your eyes, massage your face. The eyes gets relaxed, all the muscle gets relaxed. Massage your earlobe, behind the ear, in front of the ear. There is a branch called auricular branch of vagus nerve. Vagus nerve causes a profound relaxation response. Massage your carotid sinuses on both sides of the neck. Massaging carotid sinuses quiets down your cardiovascular system, nervous system. Take your hands to the back. Massage the occipital tubercle. The two muscles supplied by cranial nerve, sternomastoid and trapezius, is inserted there. You'll feel a sense of relax, then you'll be able to do proper your breathing, voluntary regulated breathing. Pranayama. Prana is a life force, yama is a control and restraint. Chanting Om Pranayam, Pranubho Pranayam, those are to quiet down your mind. But interstitial fibrosis, the most important is you have to learn how to remove the excess, the all residual air, so you can bring more oxygen in. The first and foremost we do is your Bastrika Pranayama. Bastrika is a voluntary, your active inhalation and active exhalation. And also for all of our pulmonary diseases, what we do, we wake up in the morning in our daily routine, we do after brushing our teeth, we do a tongue scraping. We use a scraper to scrape our tongue. Then we clean our nostril with a neti pot. It's a gel neti. You may have seen all of them. I do have some here. I'll keep it. It is a tongue scraper, and scraping a tongue is very important. The tongue, you don't understand this well, the connection, your breathing gets better. Neti pot, we use our standard neti pot that we have some here. Here it is. This is our good neti pot. We will fill it up with a lukewarm water. Generally, the water we use is drinkable water. It's good enough. But if you're a little concerned, you can boil your water, sterile water, put a non-iodized salt, and put it in your nostril, and slowly keep your eyes closed, breathe through your mouth, turn your head slowly, water will come out from the other nostril. Initially, it is not going to come out that much because there is a relaxation response. More and more you relaxed, and relaxation means I can talk, I can breathe, water will come out very nicely. I do it every single day, it's part of my life, and I don't miss a single day. In fact, I have a plastic one I carry, and also you can do that from other side. So this morning practices we do, and also remember your nostril. See the site between the cartilage and the bone, that's a small space. So the air which is coming in through your nostril is going through a very small channel, almost I think almost just a 3 millimeter size, maybe even less than that. So what happens if your mucus in the nostril gets dried up, blocks your nose. When it blocks your nose, and especially at night, you end up with a mouth breathing. When you wake up in the morning with your mouth is being dry, you know you've been breathing through your mouth. So we recommend called oleation. Put a little oil in the nose. In a yoga and Ayurveda practice, you have different kinds of oil in your nose, but in our daily practice, what we do before going to the bed at night with your little finger is our personal practice. Dip it into oil. What kind of oil? If you follow the Ayurveda, you can do a different oil based on your dosha. For Vata, use a sesame oil. Pitta, use a coconut oil. And Kapha, use a mustard oil. So put a little oil, put inside your nostril before going to bed. You will see, wake up in the morning, you'll see your mouth is dry, you have breathing through your nostril throughout the whole night. Very, very important. Keep the nostril open for your breathing. Jalnati is a wonderful, we do another thing also called Sutraneti, but these are our part of daily routine called Dinacharya. And then when we start doing our first practice, the first practice obviously is our quieting down your mind. And then before the pranayama practice, we do a little bit of a relaxation, a hand relaxation. As I said, put a thumb inside and close. And that's for a baby. So do it with breathing. Breathe out first. Take a deep breath in. Breathe out and do a called Bala Mushti Mudra. Breathe in. Breathe out. You can also rest. Breathe in. Breathe out. Ribs gets tightened up. The flexion, and you do a breathing in, breathing out. Paschim Namaskar. Paschim Namaskar is a chest opening poses. All the chest opening poses and staying able to stay in the chest opening poses will be very beneficial. Another also very important, all the lung function gets better when your hand strength gets better. If your hand is properly relaxed, you see my hand is relaxed, I can put my hand anywhere, my fingers will go in and out, my hands will turn around, my hands are relaxed. But if they're tight, the finger doesn't go, it's very tight. And when the hands are relaxed, you do the when your hands are relaxed, you do the hand strengthening asanas, like say for the hands, downward facing dog, or yogic push-ups, done by heart. Crane, Bakasan, Mayurasan, peacock pose, Tulasan, able to sit down in a lotus pose and raising your body high up with the hands, Tulasan. So even after all these asanas, the primary, you remember, you relax your hands, hand strength, and then do the pranayama practice. So, Bhastrika pranayama will help you to remove all the residual air and bringing more oxygen in, and it will the beginning of your practice. So Bhastrika you can do like a bellows, this is a Bhastrika pranayama. So you can do it hand raised, but it's you come down. Be sure you come down with your fist. Your Adhimudra. Slowly and slowly you can bring up the speed. And we do also every morning, we do this Jalneti. So during pranayama practice, some of the air comes out. In a Bhastrika pranayam, we do the raise your hands high up. We do a bit 20 in a slow speed, 20 in a medium speed, another 20 in a fast speed. That will be our one cycle. And we generally do 2, 3, 4 cycles. So for the time's sake, let me show it to you only 10 in different speeds, and you will be able to do, or you will be able to do without raising a hand high up, which I will also show it to you. So 10 slow speed. Medium speed. Rapid speed. We do this in cycle, and now you see that my air has gone out and come in. I'll be able to breathe in and out a lot more than 500 cc. And then breathe out first. And take a deep breath in. And completely breathe out. I have increased my regular breathing tidal volume maybe about 2, 3, 4 times. I may be breathing in and out about a liter, maybe a liter and a half. You also can do it sitting down in a chair with the spine straight and just moving your shoulder up and down. So it is a very, Bhastrika is a bellows, and I'm sure many of you city dwellers, they have not seen the bellows. A friend of mine gave it to me. This is the bellows. Breathe in. In and out. In and out. Okay, so another way of doing Bhastrika Pranayama is, remember, you start with the Bhastrika. Have your Adhimudra or Bala Mushti Mudra like a baby, because you're relaxed with this, and sit down, spine straight. did about 200 counts. It took me about a minute and a half. Generally, we do it about between 3 to 5 minutes, the count of 500, 600, but effortlessly. And effortlessly means I can talk, I can even sing. The moment you have any effort, pranayama is not helping you. Bhastrika pranayama follows with your Kapalbhati pranayama. Kapalbhati, Kapal is a forehead, Bhati is a shining. Kapalbhati means that you are shining around the floor. It means you are literally glowing around. People will say, look like you're glowing. So you will see a picture of Buddha, picture of Jesus, you will see there's aura around there. This aura comes from, it is called your Agni Pradhan Pranayama. It ignites your Jathar Agni, digestive fire. Jathar Agni increases the Teja in your body. We have Prana, Teja and Ojas. The Teja, and Teja is the glow. It's a glow we get as basically name came from Kapalbhati Pranayama. We do all the mudras with the Kapalbhati Pranayama. We've got 10 different mudras for your health and healing. But for the lung, we generally do with your Dhyana Mudra or a Jnana Mudra. Bring your awareness to your belly button. Push your belly button to the back. It will hit your diaphragm, hit the lung, and air will come out through your nostril. So if you're new to a practice, put your hand in your abdomen, hand underneath your nose, push your belly button to the inside, air will come out. And say, I'm not breathing in. This is called active exhalation. Means actively air is coming out. All the residual air which was in the lung is all coming out. But I'm breathing in between without knowing. Unconscious breathing. Why? The day I was born, I took a deep breath in. Nobody taught me how to breathe in. I have to learn how to breathe out. It also massages your internal organ. Oh, many a time people say, I cannot do it. I have a hard time doing it. How can you do it? I say, why don't you do one thing? Why don't you see if you can cough? You're coughing. So now we cough with the mouth closed. The mouth is closed, try to cough. It becomes Kapalbhati Pranayama. So you're doing it, you will see it also massages all the internal organs. Say my Dhyana Mudra, my spine straight, my eyes are closed. Massaging my liver. Massaging my stomach. Massaging my spleen. Massaging my pancreas. Massaging my colon. Massaging my small intestine. For women, it's massaging your uterus, tubes and ovaries, urinary bladder. For men, it's a prostate. Kidneys. So it massages all the intra-abdominal organ. It also massages your diaphragm, which separates in between lung and the abdomen. Very effective practice for interstitial fibrosis. Massaging the both sides of the lung, so the air is coming out from the lung. Massaging an organ makes the organ function better. It is also massaging the heart, which is sitting in between the lung. Massaging the heart is almost feels like your CPR, the cardiopulmonary resuscitation. You are massaging. We call it the internal CPR. It removes all the residual air from the lung and brings the fresh air in. Continue without any effort. In our daily practice, we have about an hour practice, 25 minutes asanas, 25 minutes pranayama, 10 minutes meditation. In a pranayama practice, we do Vastrika between 3 to 5 minutes, Kapalbhati pranayama between 5 to 10 minutes when you are effortless. But again, when you're doing breathing, it has to be like a normal breathing. You're talking, you're breathing. Both the nostrils should be open. You'll be surprised to see when you check your patency of a nostril, you'll see one nostril is more open than the other side. And then it's a cycle. A cycle revolves about almost 90 minutes. We get an alternate nostril breathing. We do a right and left nostril breathing, and then it affects both sides of your brain. Left nostril is controlled by the right brain. Right brain is intuitive, right brain is female, right brain is cooling, right brain is parasympathetic. So left nostril breathing is called your Chandranadi, moon energy. Right nostril is controlled by the left brain. Left brain is analytical, left brain is male, left brain is heating, left brain is sympathetic. So right nostril breathing is called Suranadi, sun energy. So left hand, I do the hand again, Dhanu Mudra or Gyana Mudra. With my right hand, we don't have to close all the way down, just put underneath your nostril, close your right nostril. And then first check the patency. So breathe in and out through your left nostril. Then check the opposite nostril, like a right nostril. See if it is in and out. But both nostril is fairly open. Right nostril may be a little bit less. And it also helps when I do a Jalneti, when I use every morning this neti part, it cleanses my both sides and keeps it relaxed and keeps it open. When you do alternate nostril breathing, close your right nostril, breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril, breathe out through your right nostril. Again, breathe in through your right nostril. Breathe out through your left nostril. Then put your index finger and middle finger on your third eye, and with your left hand cross your hand, hold the right earlobe, It's called super brain yoga. It balances both sides of the brain. It helps you a tremendous amount of breathing effectively through both the nostril and using both sides of the brain, and continue alternate nostril breathing. Breathe out through the left nostril and breathe in through the left nostril. Close the left nostril, breathe out through your right nostril. Breathe in through your right nostril, close your right nostril and breathe out through your left nostril. Continue this for a while, and you will see both of your nostrils are open, both sides of your brain is active. Very effective therapy for your interstitial pulmonary fibrosis. But the most important, to improve the diffusion, to improve the air getting out of the scar sac alveoli to the blood, is a breath holding. It's called kumbhak. Breath holding in inhalation, breath holding in exhalation. Breath holding in inhalation is called retention, called abhantarin kumbhak. Breath holding in exhalation is called suspension, called a bajja kumbhak. We can do alternate nostril breathing with a breath holding, which is called nadi shuddhi pranayama. This should be a part of daily practice for people with interstitial pulmonary fibrosis. Meditation mudra, dhyana mudra, jnana mudra. Use a Vishnu mudra. Put your index finger down with a little finger, ring finger and thumb made a pinch. Put the pinch over your nostril. You will be doing a sequence of 1:4:2, like 4 second in, 16 second hold, 8 second out. Then when you are able to do it, as I said, if you keep on doing it daily, you develop a habit forming neuroplasticity. In a short time, you'll be able to progress more and more and more. Let me show you a little bit progression, how to do it, and you can do it on your own. Close your right nostril, breathe out through your left nostril. Breathe in with a count of 4 in. Hold your breath for a count of 16. Breathe out through the right nostril with a count of 8 out. So this is one cycle of breath holding, nadi, shuddhi, pranayama. Now if I want to increase little bit, you will see I'll come back from the same, but let me increase the number. Let me go 5 seconds in, 20 seconds hold, 10 seconds out. From the right nostril, I'll breathe, count of 5 in. Breathe out first, count of 5 in. Hold for count of 20. Breathe out to left nostril at a count of 10 out. breath holding in inhalation with a ratio of 1:4:2. We also can do 1:2:2 is called a Shavitri Pranayama, but this is good enough. And the most important practice is your breath holding in inhalation called Abhantarin Kumbha with a chin lock. What does a chin lock does? See, we do a 3 mudras, or called the your root lock called Bandha, Mula Bandh. We do a abdominal lock called Uddiyani Bandh, which you do with the exhalation, and the chin lock, which stimulates your carotid sinuses and causes profound relaxation response. Breath holding in inhalation helps in diffusion, and breath holding in inhalation has to be done very slowly and effortlessly, and slowly the timing will increase because of neuroplasticity. When the lung starts to expand, body doesn't let it expand too much because of the rib cage, so the lung starts retracting back. That has a reflex called Herring-Brewer reflex. It is activated through your vagus nerve, and it's called a vagal activation. So, again, meditation mudra. Breathe out first. Take a deep breath in, hold your breath with a chin lock. And keep counting how long you can hold your breath. Don't force yourself. For a good yogic practice, you'll be able to do 40 to 45 seconds breath holding and inhalation, and it's a wonderful practice for your interstitial fibrosis because there will be a lot of exchange. Breath holding and exhalation is also a wonderful practice. It starts with the practice with the abdominal lock. In abdominal lock, you suck your stomach in and hold. So you will be breathing out first. Take a deep breath in, completely breathe out, suck your stomach in and hold. cough, it is a part of your pranayama practice because the cough comes from your larynx and is literally the air is going in and out through the larynx, which is a very good sign. The Agnisar Kriya, you massage your abdominal content after sucking your abdominal wall in and massage your abdominal wall. It's a very efficient practice, very effective practice. Let me show it to you one time. Adhi Mudra. Breathe out first. Take a deep breath in. Finally, you can do a Ujjayi pranayam. All the meditative pranayamas are Om pranayam, Pranabho pranayam, but Ujjayi pranayam, you relax your larynx. Larynx is supplied by superior and inferior laryngeal nerve, both of the branch of vagus nerve. It's a vagal activation, very calming, relaxing, and the efferent comes from a hypoglossal nerve and glossopharyngeal nerve. Hypoglossal nerve supplies tongue, pushes the tongue in front. It helps with the sleep apnea, and also the glossopharyngeal nerve supplies your soft palate, palatoglossus and palatopharyngeus, tightens it up, it prevents your snoring. And then Ujjayi pranayam is associated with your chin lock, which is profound activation of your carotid sinuses, and then with the left nostril breathing, which is very cooling, calming pranayama for interstitial fibrosis. And then you will do a meditative practice with the alternate nostril breathing without closing your nostril. Okay. So let's see if we can do these practices a little closer, so you'll be able to see it like a better way. Okay. First, when you do the Ujjayi pranayam, you slowly relax way, close the larynx, you breathe in and out, and it's called your ocean breathing, or you call it a Darth Vader breathing, like this. So your accessory muscles of respirations are not moving. That means you're relaxed. And then if when you do it more deeper way, what you can do is breathe out first. Take a deep breath in. It is so relaxing that you develop abdominal lock with your Ujjayi pranayama. Initially, maybe if you have to do it, you can do it in bursts like mm, 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 Coughing during Ujjayi pranayama is entirely normal. Let's see, if you do Ujjayi pranayama with the chin lock, the left nostril breathing. Very calming, cooling, relaxing, and very powerful pranayama. So it is a wonderful practice. It's a wonderful practice, and you still get some drainage from your nostril, but that is entirely normal. You get a drainage throughout the whole day because you do have some little bit of residual air in your sinuses. Very meditation is quieting down your five senses. Mind is your content of your five senses. I hear, I see, I smell, I taste, and touch. You can do a lot of meditative practice. You can do breath-centered meditation. You can do very quick 5 sense controlling meditation called pratyahara. Close your eyes. Meditation mudra in the hand. Spine straight. Visualize 5 objects around you. After proper visualization, pick up 4 objects. Listen to the sound of those 4 objects. Pick up 3 objects. Try to get a smell of all the 3 objects. Pick up 2 objects. See if you can taste those 2 objects. Pick up 1 object. Touch it and see if you can hold it. Hold it as long as you can. Now bring your awareness in both the nostrils. Without closing your right nostril, breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. Breathe in now in your silence. Do the alternate nostril breathing. I can clearly see my air is flowing through one nostril, coming out through the other nostril. Continue this meditative alternate nostril breathing for some time, as long as you can. Slowly bring your hand in front of you. Touch your little finger and thumb. Separate your ring finger, middle finger, and index finger. This is your Padma Mudra. Padma Mudra connects your body, mind, and spirit. Slowly bring the Padma Mudra close to your heart. Heart is the site of the soul. We say memorized by heart. Yoga therapy is a very effective practice. It brings the wellness in your body, mind, and spirit, maintains our health, it slows down the progression of our chronic lifestyle related disorder, and in certain situations it even reverses the condition. Bring your hands in front of your heart chakra. Get your head down, say namaste. I honor the divinity within you. You are divine. I honor the divinity. You will have a wonderful time. You will have an excellent exchange of your gases. Your blood oxygen level will be up. Carbon dioxide will be removed. All your volatile substance of your metabolism will be removed, and you will maintain a good quality life and living. Yoga therapy is not to extend your life, but make your life, give your life a quality so you can enjoy a good health and enjoy the time we have in this universe. Thank you. I may be tied up in next week or two. I'm not sure about my schedule for now, but again, if I'm in town, I'm not doing anything, if I have not other program, I'll come back to you and I'll bring your uh, requests again. This was also a request from a physician friend. Thank you for joining.